For centuries, people plunged sick bodies into cold water to fight fever and infection. In this video, you'll see how one simple method, cold baths and sponging, was used to treat illnesses such as high fevers, influenza, pneumonia, and rheumatic pain, why caregivers trusted it, and what modern medicine thinks of those ideas. Physicians or family members would sponge patients with cool water, wrap them in cold sheets, or place them in tubs. Sometimes a quick plunge, sometimes repeated baths over days, to lower heat, reduce swelling, and revive breathing. Ancient Greek and Roman doctors, medieval healers, and 19th century hydrotherapists like Vincent Priestnitz all promoted cold water for its apparent power to pull out dangerous heat or rebalance the body. Sometimes patients did improve, because cooling can temporarily reduce fever and numb pain. But cold alone did not kill microbes or cure infections. Modern medicine still borrows that cooling idea for symptom relief, but treats the causes of disease with vaccines, antibiotics, and targeted care. Stay with us to hear real historical cases, surprising successes, and costly mistakes, and what those stories teach us about how people fought sickness before modern medicine. Why cold water was considered medicine. During the 19th century, whole-body cold immersion became widely seen as a practical cure rather than a folk trick, and people used tubs, plunge baths, and sea bathing as a deliberate medical step. Physicians and lay healers alike recommended that a feverish patient be placed briefly into cool or cold water to lower body temperature, or that someone with painful joints take a short cold plunge to reduce swelling and ease the pain. The method was straightforward. The patient was immersed up to the chest or neck, held there for a short time, then usually dried and rubbed to restore warmth. It was simple, visible, and repeatable, which made it feel like real medicine to patients and caregivers. Practitioners pointed to specific illnesses as reasons to use full-body cold immersion. Feverish conditions such as influenza were commonly treated this way because a quick cooling bath could reduce intense heat and bring immediate relief. People with chronic joint pain labeled rheumatism or gout were sent to plunge pools or sea baths to reduce pain and stiffness. Many reported improved mobility after repeated immersions. Some patients with persistent coughs and wasting conditions were encouraged to take cold seawater dips as part of a regimen that promoters claimed strengthened the lungs and the overall constitution. Athletes and laborers also used brief cold plunges to help recovery after strenuous exertion, long before modern sports medicine formalized those ideas. The reasons people trusted cold immersion were a mix of direct observation and prevailing health ideas. A cold plunge produced an obvious, fast change. Flushed skin went pale, breathing shifted, and a person often felt alert afterward. That visible response made it easy to conclude the treatment was working. Many healers explained the benefit in plain terms. Cold water reduced dangerous heat and fevers, tightened swollen tissues, and roused a sluggish circulation or nervous system. Because medicines were costly or scarce, an accessible tub or the seaside looked attractive as a cure that anyone could use. The ritual of immersion, a clear action with immediate results, reinforced belief in its medicinal value. Modern medicine recognizes some of those benefits while adding limits and controls. Controlled cold water immersion can reduce swelling and help muscle recovery, and cooling remains a primary method to treat dangerously high fevers in emergency settings. At the same time, doctors now understand that immersion is not a cure-all. Infections require antibiotics. Many chronic diseases need targeted drugs or procedures, and unregulated cold plunges can be harmful for people with heart disease or weakened immunity. In short, full-body cold immersion survives as a useful tool in specific, evidence-backed roles, but it no longer stands alone as the broad, catch-all treatment it once appeared to be. How cold water was used to treat disease. Cold water immersion was a common, hands-on treatment used by caregivers and physicians to manage a variety of illnesses when drugs and advanced hospital care were not available. Practitioners turned to full or partial cold baths, plunges, and rapid sponge downs to try to lower high fevers, ease severe skin inflammation and smallpox, calm the delirium and dehydration seen in cholera, and reduce chest discomfort in pneumonia. People with rheumatic pain or swollen joints were sometimes immersed as well, because immersion was thought to lessen inflammation and relieve stiffness. The method itself was straightforward and practical. Patients were helped into tubs, rivers, or specially prepared plunge baths and immersed up to the chest or neck for brief periods. Or they received repeated spongings with cold water applied to key areas such as the forehead, neck, and torso. Variations included alternations between cold and tepid water, quick dousing from buckets, or standing under cold water streams. After immersion, the person was usually dried and wrapped warmly or given blankets to moderate the cooling effect. Caregivers watched for signs of distress and adjusted treatment by shortening exposure or using only partial baths when patients were weak. People used cold immersion for a few simple reasons that made sense without modern science. Cooling the skin and surface tissues visibly lowered heat and produced rapid symptom relief, so feverish patients felt better. The sudden shock of cold was believed to drive out illness or reset an upset body, and the refreshing sensation helped calm agitated or delirious patients. For contagious pustular diseases like smallpox, cold wetting was also applied to soothe painful eruptions and reduce the burning sensation that accompanied high fevers. In cholera care, cold applications were part of a bundle of measures intended to comfort the very weak and sometimes slow dangerous overheating or collapse. Modern medicine interprets those effects more selectively. Controlled cooling can be life-saving in specific emergencies, and targeted cold therapy is used today for certain needs, such as treating heat stroke or in clinical protocols that reduce brain injury after cardiac arrest. For ordinary infections like pneumonia or smallpox, however, modern care focuses on hydration, specific antimicrobial drugs when needed, and careful fever control rather than routine cold plunges. Unsupervised or prolonged cold immersion can provoke shivering, place extra strain on the heart and lungs, and worsen outcomes in frail patients, which explains why modern clinicians reserve such measures for narrow, supervised situations. The historical use of cold water immersion shows how accessible, visible treatments shaped expectations of care. It offered immediate relief and a clear action for families and healers confronting dangerous illness. Viewed through today's knowledge, cold immersion can be a useful symptom reliever in some settings, but it is not a substitute for rehydration, infection-specific treatments, and modern medical monitoring. Did cold water therapy actually work? During the 19th century, many physicians and spa practitioners turned to cold water immersion, full baths or plunges, to treat a range of illnesses, from high fevers to aching joints. They used simple methods. A patient would be immersed up to the neck or take a brisk cold bath for a short time, sometimes followed by wrapping in warm blankets. Practitioners believed that shock from cold and the following rewarming would reset the body's balance, reduce fever, and relieve pain. So the plunge was offered for respiratory infections like influenza and severe bronchial illness, for fevers in general, and for rheumatic pain and arthritis. Reports from hospitals and spa resorts describe dramatic cooling of a hot patient and temporary relief of symptoms after a plunge, which helped the method spread. Cold plunges could and did produce real, observable effects. A hot, feverish person often cooled down quickly after immersion and became clearer in mind, because the cold water lowers skin temperature and reduces the felt intensity of heat. This was useful for treating fevers and the discomfort of influenza or pneumonia. Pain in joints and muscles sometimes eased after a short immersion, giving people better mobility afterward. Those short-term benefits meant patients sometimes improved enough to eat, sleep, or tolerate other treatments. It is important to note, however, that while symptoms could improve, plunges did not cure bacterial infections or replace the need for treatments that addressed the cause, such as antibiotics used later in medicine. People saw cold plunges as more than a medical tool. They were a ritual with practical steps and clear rules. Patients were often introduced gradually to colder water, supervised by attendants, and followed by controlled rewarming to avoid shock. In communal bathhouses and hospital wards, the practice was standardized: brief immersion, quick drying, and rest under blankets. This structure mattered because sudden, prolonged immersion could be dangerous, causing fainting, heart strain, or hypothermia. So practitioners who knew how to time and monitor treatments could get better results and fewer complications. Modern medicine looks at those historical effects with nuance. Some of what immersion accomplished is confirmed: lowering fever, reducing swelling and pain for a short time, and aiding recovery after strenuous activity. Athletes today use cold water immersion for muscle recovery, which mirrors the old practice in purpose, if not in context. But modern science also makes clear limits. Plunges do not eradicate pathogens and can harm people with heart disease or vulnerable circulation. Today, cold immersion is a symptom management tool, not a cure for infections, and it is used alongside targeted treatments such as vaccines, antimicrobials, and supportive care. In short, cold water immersion did work in the sense that it often produced quick, useful relief of fever, pain, and mental agitation. It improved comfort and sometimes allowed patients to participate in other aspects of care. It was not a universal cure, though, and its effectiveness depended on correct application, the type of illness, and the patient's overall health. The historical fascination with plunges shows both the practical value of symptom relief and the limits of treatments used before modern, disease-specific medicine existed. If you've ever wondered why people used cold water to treat illness before modern medicine, it helps to picture one simple method: cold baths and cold compresses. People soaked in cool water or wrapped cold cloths around the forehead, chest, or limbs to lower a fever, soothe aching joints, and help clean and calm wounds. Historically, doctors and healers from Hippocrates to 19th century hydrotherapists recommended this approach because they saw fast, visible results: skin cooled, pain eased, and restless patients calmed. It was used for fevers, including influenza and other high-temperature illnesses, rheumatic pain and arthritis, and as a first step in wound and skin care. The idea was practical and immediate: cool the body where it hurt and symptoms often improved. In simple physiological terms, cold can reduce swelling and make the area feel less painful, but it doesn't replace treatments that actually fight infection, repair tissue, or prevent disease. Modern medicine relies on vaccines, antibiotics, anti-inflammatories, and precise care. Cold water remains a helpful, supportive tool for short-term relief, not a cure. It can also be risky if used too long or on very weak patients. To summarize the key points, cold baths and compresses were a widespread, low-tech therapy used to cool fevers, relieve pain, and soothe wounds. They offered real symptom relief historically, but are not substitutes for modern medical treatment. If this story sparked your curiosity, tell us in the comments which old remedy you want explained next. Subscribe if you want more short histories like this. Next time, we'll explore Sebastian Neep's cold water walks and how his methods influence today's wellness practices.